Now let's get started with today's event. First, I would like to thank our sponsors who make events like this possible, AbbVie and Genentech. Okay, the topic of our event today is tips for managing anxiety and depression as a CLL patient. Our agenda, first I'll introduce our speaker, psychotherapist Ana Sahagun. Ana will then spend the next 30 minutes giving us her presentation. After the presentation, we will open it up for your questions and comments. So let me take a second to introduce our speaker, Ana Sahagun. Ana is an engineer and a psychotherapist. She has experience in both fields and loves them equally. She leads the patient experience team at the HealthTree Foundation, and she's passionate about talking to patients and empowering them. Whenever she's not working, you'll find her exploring the world, eating different kinds of foods, hiking, or skiing. So with that, I am going to turn it over to Ana.
Hello, everyone, and welcome. Super happy to be here with you today. And well, hopefully this presentation will be of use. And without further ado, let's start. Let me share my screen. And start presenting. Perfect. So today, as Megan mentioned, thank you, Megan, for inviting me today. We're going to talk about how to manage anxiety and depression as a CLL patient. Just first things first, so you know, this presentation is not intended for clinical depression and/or anxiety and does not constitute mental health treatment. If you need help, please contact your healthcare provider. And at the end, we're going to talk about some options, but just wanted to make this clear before we start. So first things first, how are you today? And this is a question not for you to answer out loud, but inside of you, how are you feeling? So first, I want you to ground yourself. This means I want you to see and feel where you're sitting and how does the chair or the sofa feels against your body, and how do your feet feel against the floor if they're on the floor. Your back, can you feel your back? Okay. And now I want you to ask yourself, how are you feeling today? You might be feeling overwhelmed. You might be feeling happy. It's a sunny day here. Probably. You might be feeling sad. You might be feeling angry. And then, now that you know, place that feeling somewhere in your body. Do you feel it in your chest? Do you feel it in your stomach? Your hands, probably. Your head? Where is it? If you can find a color to put on it, pick a color. Is it black? Is it blue? And then, does it have a texture? How's that texture? And at last, you can choose a name for it if you want. You can just call the name of the feeling, happiness, sadness, but you could choose another name if you want. So now that you know how you're feeling today and that you're grounded, you know where you are. This is a quick technique that you can do anywhere when you're feeling anxious or depressed. Just when we are feeling that way, sometimes we're kind of like outside of our bodies. So where am I? Where am I? Where am I sitting? How does it feel? Where are my feet? And that's how we ground. And then you can keep going. So let's keep going. I want to start by having a kind of like outline, like where we are. So this is something that you already know, but I just want to put it in words and talk about it. A cancer diagnosis is something that brings uncertainty because life's plans change. You have treatments, you have side effects, your quality of life might not be the same or will not be the same, and loss. And sometimes we don't think about this loss. For example, you probably don't have the ability to do some of the things the way you used to. And that's loss. To lose your health, to lose the way that you use things, that you probably you're not seeing the same friends anymore. There are different things that you lose after a cancer diagnosis. And sometimes we don't think about that. We think about the disease. We think of what's coming next, and we feel anxious about the future. But sometimes we forget that we're losing a lot of things. And when you lose someone, you go through stages of grief. And I just want you today to recognize that you might go through all these stages for different things. Okay, so first, you already heard about this, but again, let's just make it yours. Make this yours today. Think about something you lost. First, you go through denial because you don't want to lose it, and then anger, and then you bargain, like, hey, I don't, like, what if this didn't happen? And then you feel sad because that's when you realize, hey, I don't have it anymore. And at the end, you accept it. Let's think about where you're standing today on all these stages and for different things. You might be on different stages for different things that you're going through and different losses. So just probably right now at this time, you won't have enough time to think about all these. I'm going to share my presentation with Megan so she can email this to you. And then you can do this exercise at home. A pen and paper would be great. And then start listing everything that you lost or that you're losing. Think about how this is feeling and where you are. And just be there. Be there for yourself. Okay? So also, one thing that I want to talk about is that both anxiety and depression have a function. They're here for a reason. So a certain level of anxiety helps us move forward, create a plan, and act. And a healthy level of sadness helps us digest our experiences. So again, here I'm not talking about clinical anxiety and depression, clinical depression. These are just like regular levels that are just what's supposed to be, and they have a function. So this anxiety will help you move, decide, okay, what do I need to do next? Do I need a specialist? Where's that specialist? I need to make an appointment. Okay, I need to learn about CLL. What is it? And what do you do about it? What's the treatment? What are the side effects? How do I need to prepare? And then we have a lot of webinars here at HealthTree about finances and, okay, how are my finances doing? and how I'm gonna deal with this. Do I need to change my insurance? All this acting is because we're feeling anxious and we don't know what to do, and we just need to start a plan and act. So I just want you to understand that anxiety, again, just healthy levels, and at the end we can talk about when you it's a good time to see a psychologist, but healthy levels of anxiety, which are uncomfortable, help us move forward. And then sadness, it just helps us digest our experience. And then that's when we go back to the stages of grief. So we have depression here. It's just part of the process. It helps us process what we're going through. And then we can move forward. So again, these feelings are expected. And I would like you to be compassionate with yourself, as if you were helping your best friend or your loved one, anyone. Probably picture someone in your head. Sometimes we are super harsh with us, and we wouldn't be that way with someone else and someone we love. We would be more compassionate. We would teach them, hey, you need to understand that what you're going through is just very hard, and it's normal to feel this way. So the way that you would do it with that person, do it with yourself. One of the first questions that I want you to ask yourself is, are you comfortable with emotions, or do you avoid them? Probably you are. If you already are, this is not for you. But if you're not, probably a good first step is to talk about them. It could be with a friend, a family member, other CLL patients. Sometimes it's good to talk about this with someone that's going through the same things as we are. So other CLL patients can be a good option, support group. But if you are not comfortable with emotions, what you usually do is just move forward. Hey, I'm feeling depressed. Doesn't matter. Keep going. Let's go. That's perfect. I know that you are very strong, but you need to stop. If you don't stop, this is just gonna, anxiety and depression are going to keep happening and at a higher level. Okay, so that's our first question. Are you comfortable? If not, talk about them with someone. Again, if this is something that you think that's disrupting your life too much, then it has to be a professional. If not, it can be a friend, a family member. Okay, now that we have set the ground, what else? What else can you do for this? So one thing that I would like you to do after the presentation, again, we didn't have enough time to do this as a workshop, also because I want to leave enough time for questions, is make a list of the things that you think are contributing to your depression or anxiety. Grab a piece of paper, a pen, sit down, go to a park or somewhere that you'll feel comfortable, you'll be with yourself, you won't be interrupted, and divide those into the things that you can change with help. It can be with help, that's okay, and the things that you can't. For example, the things that you can't change. Okay, you're gonna receive treatment. I mean, you could say no to treatment, but I guess if that's the best way to treat your CLL, that's why you would like to do, right? But so you're gonna go through treatment that there's nothing that you can't do about it, but that's making you anxious. Write it down. What can you do about it? Okay, well, I haven't done any research about the treatment. So I don't know about the treatment. So do my research, read about it. If you understand it, anxiety. Well, this depends a lot on the person, but it might diminish it, because sometimes this anxiety is anxiety for the things that we don't know are happening. And if we know what exactly is happening, it helps. But again, some people, some others, it doesn't, because you might have recurring thoughts about what will happen. Again, if those thoughts are being too strong and you are not being able to live your life normally, then you need to seek professional help. Okay. So now, once you have divided them, we're gonna focus first on the things that you can change. All right. So you have to assign a person to each listed thing that can be changed. This can be you, or this can be someone else, or both. So I'm going to do some research about my treatment. I need to look at my insurance, and I just can't do it. I need help. Okay, I'm going to ask my daughter to help with this. I don't know what else. I need to declutter. We had someone asking for help to declutter their home before treatment. I need to do that. I wanna make my home cleaner and just with the essential things before I go through treatment. I need help. Who can help me? My neighbors. Okay, someone from church. Perfect. Make a list and then assign a timeline. It can be a timeline to start, to finish, to talk about it with someone else. Just put dates and put it in your calendar. On Monday, I'm gonna talk to my daughter, and I'm gonna talk to her about my insurance, and I'm gonna tell her that I need help and that I need her help, and have them commit. Hey, when can you get back to me on this? Can you help me do the research? When can you get back to me? Can we have this talk again a week from now? And put them in their calendar if you need to. Make a plan. Sometimes we have a lot of anxiety because there are so many things going on. Again, we go back to the beginning. Our plans change, our life changes, our quality of life might change. So there's so many things going on, and sometimes we cannot manage with them all, and that's okay. And we need help. So when you write them down and then you put a person to help with it, or maybe yourself, and then you put a date, that might help the anxiety go lower, because we're acting and we're doing what the anxiety is asking us to do, for the things that we can change. And then we'll talk to your support system, ask for help, and be clear. So to whomever you assign something, be very clear of what you want. Sometimes what we humans do is we ask for help, but we're not as clear. We just are super general. And then when people doesn't do the exact things that we want, we're like, hey, no, I didn't want this. Sometimes we get mad and we don't tell them. Or sometimes we get sad. Hey, you didn't do this for me. So let's just be super clear. This is what I want. This is a date that I want it by. If you can help me, of course, if you want to. But let's be very, very clear. Very clear of what you need, what you want. That's very important. Okay, and then I also want you to think about other situations that you need your attention. Undigested life events, family situations. Sometimes we go through life and then things happen and we don't stop. We get on a fight with our sister, and then we just keep going and act normally, but we don't talk about it. I don't know, something else happened to you or with a friend, or you lose your job, and then you just keep going and then find a new one, but you never stopped to think how that event affected you. And when we get a stronger life event, then all these things come back. and they're a burden. We're carrying them. We have not digested them, and we need to do that. We need to stop. So if there's anything that you haven't digested yet, if there's anything that's bothering you, hey, or when we're sick, sometimes we ask things like, hey, probably it's time for me to talk to my daughter and just about X and Y. So we think about all these life decisions that we were not thinking about them. We were just keep going and advancing in life. So we need to stop. All right. Think about those. Think about those, write them down, and make a plan. Are you going to talk to that person? Are you going to go to therapy? What are you going to do about this? And that when you digest, doesn't mean that you're going to solve them. You're going to digest them. You're going to allow yourself to feel them and to know what this did to you, and then keep going. And then Megan, I just realized that I don't have a clock anywhere here. How long, how much time do I have?
So we have about 7 minutes. If you need to go over, that's fine if we want to shorten the amount of time for questions.
Okay, no, I'll try to do 7 minutes. Thank you. Okay, so this is super personal, but something that I love is family therapy. Because when you get diagnosed and you're going through all these treatments and everything, your quality of life changes, everything that you're going through, it doesn't only affect you, but the people around you. And sometimes you might need help to talk about that with someone else. And like someone else to help you to talk about that. And that can be a therapist. So family therapy, it's a good way to do it. Also, if there are things that happened in the past that you haven't talked about it with your family, this would be a good time to do it. And then talk about your diagnosis, how everyone's feeling, because your loved ones, and if when someone you love gets sick, you are devastated, so sad. You want to help them, and sometimes you don't know how to. So you can try to do it by yourself. But also, if you feel like you need more help, you can try family therapy, and you can have everyone there and talk about what's going on and what you need and how you're feeling and how everyone's feeling, because you're not the only one having feelings about the disease. So it's a very hard thing to do, but it's gonna really, really help to talk about these things. So if you haven't figured yet, the approach that we're taking is to stop focusing so much on the anxiety and depression and more on what's causing it, what's causing my anxiety and depression. And then I bet you had the question, but okay, yes, I do that for the things that I can change. Probably you already did it, everything's solved. But how do you manage things that you can't control? Like having treatment, I'm starting treatment today. That makes me feel anxious. So there are some things that I want to make clear. So the more you try to stop anxiety and depression from happening, the more they will happen. That's for sure. So think about that. If you like to avoid them, don't do it. Embrace them. It's hard. It's really hard. I know, but you can do it. And more than focusing how to deal with emotions, accept to be with them with compassion. So we think a lot. We're problem solvers. And when I came to the US, I found that in the culture, which is great, but we're solving all the time. Everyone's solving everything all the time. Okay, I have this problem. What do I do about it? And then solve. And sometimes with emotions, we want to do something. Hey, like just at work. Okay, I prepare my presentation and I do it and I study hard and then check. It doesn't work this way with emotions. We need to stop. We need to accept them. We need to be compassionate with ourselves. Because sometimes we're like, hey, why? Why am I this sad? I don't want to be sad. Why am I feeling this anxious? I hate it. Like, why can't I control it? You do not control anxiety or depression or any emotion. You accept them. And then you are with them with compassion. That means I understand that I have depression. I understand that I have anxiety because I'm going through all of this. And it's hard. It's so hard. And it's okay to feel this way. So to stop and digest what's happening to you, it's going to be hard because what you are dealing with, it's not something easy. It's really hard, but you'll feel much better after. So this might probably be the hardest thing you'll ever do. You cannot solve this with study hard, do this, do that. You have to be present. You have to stop. You have to feel them. Otherwise, you won't be able to move forward with these emotions. So again, you need to stop. If you don't, and you don't process it, you'll keep showing symptoms. So as a recap, don't try to stop anxiety or depression. Observe them. Where are you feeling them? Just as we did in the beginning. How do they look? Do they have a color, a texture, a name? Understand why they're here. Why are you feeling them? Yeah, and it's pretty obvious. Well, just sit with it. No judgment. Okay? As if you were talking to your best friend. It's okay to feel that way. It's just natural. And compassion. It's okay to feel that way for a period of time. And I'm going to be here for myself, not judge myself, and just give a big hug to myself and ask for help for me. And then back to clinical depression and anxiety. These are serious conditions. They require tailored psychological treatment. Unfortunately, this cannot be solved with a presentation. I wish I could help you. And you need to seek help. You can ask your clinic if they have a psycho-oncology department. That's therapy for cancer patients. If they don't, you can go to any other therapist to help you deal with everything that's going on. And then I want to finish with a quote from one of my favorite professors that I have during my master's degree. And he said one day, to heal emotionally is to recover the right to feel what we are already feeling and to ask for what we need. Again, to heal emotionally is to recover the right to feel what we're already feeling and to ask for what we need. Okay. Okay. So we're going to start with questions now. I'm going to start with the first one and then I'll let Megan do those. So we had a question from the audience in, I don't know if it was by email or the chat. And they asked, how do you handle people and family members putting pressure on you to live your life when they really don't understand the constraints of the disease? So I don't know what this person already tried. If you're here and you want to share more, we'll be happy to hear. I'm gonna just give like a quick response, but if you want to share with us, we can keep the conversation. But again, remember the stages of grief. The people that are helping us, they're also dealing with them. Okay, they're losing a healthy family member. And that hurts. It hurts you to see people you love suffer. So maybe they're in the denial phase And maybe they're just trying to help by saying, hey, keep living your life as you were doing it. Just live it, enjoy it. What they're doing is trying to help. What can you do? Talk to them. So you already did. So again, I don't know what you already told them, but just sit down. Hey, can we have coffee one day? I want to talk about this. So this is how I'm feeling. These are my side effects, and this is what would help me. Again, we have to be very clear with people and asking what we really need. So how can they help? All right. So this is what I would do. Talk to them and be clear about everything that we're feeling and give them a solution. Sometimes we kind of say like, hey, no, don't do that. But what can you do? This is what you can do. And this is what would actually help me. There are some caregiver events. You can invite them to those groups in like Facebook support groups for caregivers. I think that can, even if they're not giving their direct care to you, maybe that helps. You can invite them to watch some videos about your disease and read about it with you. Just yeah, help them, educate them on what you're going through. And well, that's all I had. And I'll be here for your questions. Thank you.
Thank you so much, Anna, for your presentation. We really appreciate it. Share my screen again. So, like you stated, it's now time for the discussion part of today's event. As a reminder, you can ask questions or make a comment by typing it in the chat box or by raising your hand if you'd like to speak. If raising your hand, once you're called on, you can then unmute yourself. So as we're waiting for questions to come in, I had a patient that asked a question, a couple patients that pre-submitted questions as they were unable to be here, but that I wanted to just get your perspective on, Anna. So you stated that there is a certain point, like between experiencing general anxiety, as this is to help me move forward. And then there is clinical anxiety, and then the same with depression. How can someone know if they are just feeling general anxiety versus at what point, what symptoms do they need to get, should they seek out professional help?
Okay, so first I would say talk to your healthcare professional if you're unsure. All right, they have screening tools. Probably you've already been screened with these questionnaires. If you haven't asked for them, but some things are for anxiety, all these like panic attacks, things that are not helping you move forward with your life, or if they're there all the time where you're more anxious, like you're anxious most part of your day, right? So that's when you need professional help. Of course, if you cannot seem to do the things that you used to because anxiety is stopping you, like I used to drive my car to work and I cannot go to clinic, cannot drive because I get a panic attack. I just get super anxious. And all those things that are just stopping you from living your regular life, mentally speaking, not physically. And depression, I would definitely recommend you to get screened. There are different questions that they're going to ask you, but if you have thoughts of self-harm, or harming someone else, but this is usually yourself, just seek help. If you find yourself being more sad, like being sad most of the day, then yeah, definitely seek professional help. And then if you want it, right? So probably it's not as bad, but you just want help. And therapy is a way to do all these processes with all these emotions that you are dealing with, that they're expected and normal. So it's help with what you're going through. So probably it's not as bad, but you want help. Yeah, hey, just go and ask for help and seek professional help. That's perfectly fine.
Wonderful. Thank you so much for answering that. That's very helpful. Awesome. Okay. And then another question that a patient pre-submitted. So there are different techniques that you can learn inside of therapy. One of the ones that you mentioned at the beginning was like the grounding exercise that can help bring you to the present, make you aware of those emotions so you can start to work through them. Other techniques such as mindfulness or deep breathing. Once you learn like an effective technique to manage anxiety, do you know how long approximately it will take to essentially rewire the brain, help you establish that as a habit?
Um, no, I think that this depends on the level of anxiety and depression that you have, and also if you're doing all that um, deep work of understanding why they're here. So I think, but this is more like my personal approach. Techniques are great and they're here to help us, definitely. And that's why the focus of my approach was more on focusing on what's causing all this, rather than on how to fix the anxiety and the depression, right? So unfortunately, I don't have an answer for that. But yeah, hope that helps.
Yeah, that's totally fine. No, I really appreciate you coming from a perspective of more what's causing the issue and dealing with the early stages, right? The main source, as opposed to just managing the symptoms. So thank you for that. Okay. Just a reminder, feel free to turn your camera on if you would like, and raise your hand if you have any questions for Ana. And then you are also welcome to put them in the chat if you have a question you would like to ask her. Okay. So more patient questions that were pre-submitted. This patient stated they feel like they have a good support system at home, but they worry that they often talk too much about things that overwhelm them, and they don't want to negatively impact their family's mental health. But they also want to try and keep them in the loop of what is bothering them. What would you suggest? How do they go about finding a good balance between what things do I share with a counselor versus what things are still okay to share at home?
Okay, I think this is something that as a family can also be established if you, I feel like the question is kind of like take everyone into account, right? So probably you can set days and times to talk about this, and not only how you are, but how they're doing, right? With when you're dealing with all this, and especially when they can help you. So if telling them X or Y goes along with a request of, hey, and this is how you can help me, I think that's perfect. That's great. I understand how you don't want like every dinner to be the talk of what you're feeling. So I would say also ask them. Sometimes we feel like we're being a burden when we really are not. So, hey, like, is this overwhelming you too much? Probably we don't talk about it at dinner, and then we talk about it after or before. I think this is specific to every person and every family. So come up with a plan as a family, ask them how they're feeling about this. And if it's something that they can help you with, totally tell them, like, yeah, do not save those for therapy. Just be straight and direct of what you need and what you want.
That makes sense. Thank you. Are there specific counselors that help in the realm of cancer diagnosed patients? So like an oncology therapist that you know of?
Not that I know of. Probably we can do some research at HealthTree. I think that'll be a great resource to share with patients, definitely. But yeah, just ask your clinic if they have an psycho-oncology department, and that would be a good one to find, because they're focused on oncology patients.
Good to know. Thank you so much. Okay. How can I maintain a sense of normalcy and continue to do the things I love despite my diagnosis and anxiety? So that was another question submitted that a patient would like to know.
Yeah. Well, if it's so high that it's keeping you from doing the things you like, then I think the best thing to do is to seek professional help. That would be the answer. If you feel anxious, or you feel depression from time to time when you're about to have treatment, when you're about to learn your test results, well, that's natural, right? So then it might be just like some days when you cannot live the way you used to, but hey, I mean, what you're going through is really hard. So I would say it's expected. But if it's keeping you from doing these things in your daily life, then I think it's time to seek help.
Thank you so much for answering that. Okay. One patient stated that they are having difficulty. What is your in the realm of like work relationships of they are going through treatment and have to take time off to get infusions for Gazyva, but they feel like their boss is not very understanding of the situation and they are just struggling with how to best communicate. Do you have any tips for effective communication of prioritizing their well-being while also balancing their work?
Okay. Yeah, that's a great question. Sometimes it's hard to change the other side, right? So I would say just first think about if you've expressed everything correctly, what you're going through, the side effects of your treatment when you have it. Because sometimes we think people know what we're going through, what it means. Some people might not know what happens after treatment, right? And how you feel, or so probably explain further what you are going through. And then I'm not very familiar with when it comes to work law, and I think we have an event. So I'm gonna look for it, Megan, and share it with you as well, so our patients can see that event as well, because I think that will definitely explain it better. I definitely not an expert on that.
That's okay. Thank you for your honesty. I appreciate that. Okay. So, a couple other questions, and then we will take a look to wrap up here. What are the most common symptoms of someone realizing that they're experiencing anxiety? In the beginning exercise, you stated like feel that in your body. For anxiety, are there specific locations that people generally feel that? Like, is it like a tightening in the chest? Is it like a clenching of fists? Sometimes like I grind my teeth when I'm anxious. Things that people can be aware of to then say, oh, I need to take a step back. I need to walk through, do my grounding exercises, and take a list to start to then feel better.
Yeah, of course. So yeah, I'm sweating hands as well. I love it, Megan, because you made the question, but you answer most of it. So that's great. uh, so yeah, also sweating hands, and as you said, the chest, heart. Sometimes people is like, hey, I don't know if my heart is working appropriately, right? It's probably beating too fast. Your breath. Sometimes you feel like there's a lack of oxygen, or that you're not being able to breathe normally. And then sometimes it paralyzes you. Your body feels paralyzed, that you cannot move some parts of your body. And to cover them all, I would say anything that's not right normal. So if there's something in your body, and probably a good exercise would be, as you mentioned before, meditation and just being aware of our bodies and embodiment, so we can know how our body normally feels and identify when we're feeling something else.
Thank you for confirming that and then adding to it. That's very helpful. Similar for depression, what are the main things of like, this is going through my body, that someone could say, okay, I'm experiencing these symptoms of depression. I need to do my list, break things down, look at the source. What have you seen from your experience that patients can also look for?
Yeah, so for depression, it would be like you're too tired. This is hard when you're going through treatment, because it can be due to treatment. So sometimes it's hard to identify. But another one that's easier is you're not excited about things anymore. The things you used to be excited about, like talking to a friend, going to a movie. I don't know if you used to love gardening. So anything that you used to be excited about and you're not anymore, that would be another one. Thoughts of, hey, I would just rather disappear from this world because this is just too hard. That's clinical depression. You definitely need to look for help. But just like that sadness, and people usually feels it in the chest, or just they stop feeling energy in their body. It's hard to wake up. Probably sleeping too much. But again, when you're getting treatment, it's hard to identify what's causing what, right? But yeah, that would be depression.
Awesome. Thank you so much for answering that, Anna, and your helpful presentation. Very valuable skills to support patients as they're working through this illness that no one asked for. And we really appreciate everyone being here, for your participation and helping us build this community and sorry that you're going through this diagnosis, but we are excited as a HealthTree patient focused organization to support you and your needs the best way that we can. So with that, we're going to go ahead and wrap up our presentation. If any of you do have questions later for Ana or about anything related to your diagnosis, we are happy to answer them. So let me go ahead and share my screen. There are two more things I want to touch on before we head out today. So one of the things we are very excited about to announce in the upcoming months is called HealthTree Cure Hub. And we have this currently in myeloma, and we are going to be expanding it to other diseases. Some of you may have seen the introductory video of Cure Hub at the beginning, prior to the presentation. But HealthTree Cure Hub is a platform that provides several features helpful for patients, such as it will give you the ability to connect your medical records securely so that you can track your labs. You will have the capacity to participate in research surveys and studies. With the power of research, we're excited to accelerate a CLL cure. HealthTree Cure Hub will also provide patients the ability to have a personalized clinical trial finder that can intelligently sort through your medical data and match you to clinical trials based on your genetics and treatment history. There are also other areas in Cure Hub that we are very excited about, such as the side effect solutions page, and in the future, even a twin machine that you can find other CLL patients that have had similar treatment history to you. So again, this will be available in the upcoming months, the majority of these features. So in anticipation for that, we invite you to connect your medical records, and you will have first access to these wonderful programs. And you can connect those medical records and look at Cure Hub by visiting the link at the bottom of this slide. I'd also like to mention our next adult CLL webinars that will take place in May and June. On May 13th, we'll be talking about bispecific antibodies for CLL with Dr. Adam Kate. And on June 26th, we will hear from Dr. Carrie Rogers about treatment options for relapsed refractory CLL. You can visit the link at the bottom of this slide to register for these upcoming events. I again want to take a moment to thank our HealthTree community for CLL sponsors, without whom this event would not be possible, AbbVie and Genentech. And thank you so much, everyone, for helping us build a strong HealthTree community for CLL. Appreciate you all, and I hope you have a great rest of your day. I hope to see you again soon, and please don't hesitate to reach out if you have any questions about HealthTree or upcoming events. Thank you so much.